All right, let's go ahead and begin. Again, I'm the executive director of the North Carolina Caring Dental Professionals, and what I say here today does not necessarily reflect the policies or opinions of the organization. So we're going to talk about three areas: substance abuse disorders, sort of known as addictions, so we call it that, and also mental health issues in dentistry, and then a little bit about burnout and some of the solutions that we can use to mitigate that. So with substance use disorder, we have the usual drugs, if you will, the injectables and the pills, but we also have alcohol that's involved. As you know, substance use disorder, a simple definition that I like to remember, it is a disease. It is a disease process, and the disease process has signs and symptoms associated with it. So it's a disease process earmarked by continued use of either a psychoactive substance or a behavior. And psychoactive substances obviously are drugs and alcohol, and then behaviors could be anything from gambling to food addictions, different types of behavioral addictions. And it's incurred, or we use those drugs in spite of physical, psychological, or social harm to self or to others. And obviously that's why we call substance abuse disorders or addiction a family disease, because when the person who has the addiction is not doing well, the family is kind of on a downspin. When the person is doing better and making their commitments in life and not using drugs or alcohol, the family seems to be up. And so it's like a constant roller coaster of emotions that evolve around the family system. Many etiological factors involved, but the two main ones are the environmental and genetic. We know from research, these two components, that about 40 to 60% of all substance abuse disorders are involved in the environment, potentially impacted by the environment, and 40 to 60% have to do with genetics. Genetics we can't do a whole lot about, obviously, but they are coming out with some vaccines on some laboratory animals that might be potentially used for humans down the road that might have a genetic vulnerability. But the environment we can do something about, and that's why in the 12-step programs that people attend to help stay in recovery, we talk about changing the people, places, and things, so they can't hang around the same people and do the same things and expect a different result. So this is sort of the two major components: environmental and genetic. Addiction is a disease of feelings. Remember this. It's important because everyone drinks for the same reason: to change the way they feel. I have had this conversation before with many people about, that I have to drink wine because it's medically good for me. Well, of course, there's no daily allowance of alcohol that the AMA or anyone recommends for the human being. Alcohol is not a necessary nutrient. However, I'll mention things like, well, why don't you drink grape juice instead? It has the same chemicals as wine. And of course, the answer is always, well, it doesn't taste as good and it doesn't relax me like wine does. And there's nothing wrong with having a glass of wine. I'm not saying there is, but for those who have substance use disorders, that's not a good idea to do that, because it can continue to make you feel as if you are in a constant spin and your addiction continues to exacerbate as time goes on, potentially. I do want to tell you a little bit about the different areas that you're going to see in patients, what's causing deaths in the U.S. and as far as drugs and alcohol and inactivity or activity. So the National Center for Drug Abuse Statistics just reported about a 500,000 people a year die from tobacco and tobacco-related substances or activities: dipping, smoking, vaping. And so you're looking at about 480,000 deaths occurring there per year. You also have poor physical health or inactivity accounting for about 300,000 deaths a year. And then illegal drugs, the number that came out in 2021 was 107,000 total deaths from all overdoses. That number is actually, as of January 1st of 2023, topped over a little bit more than 109,000 deaths going back a 12-month period. And then when you look at alcohol, the alcohol-related deaths, which is not included, obviously, in the illegal drug deaths or overdoses, certainly is around 90,000, 95,000. And then when you have alcohol-related deaths that are usually associated with some mental health issues, and also like 1 in 6 of these have been associated with an opioid, you have over 140,000 deaths. So we know these are the culprits. These are what this is not rocket science, but it kind of puts some hard numbers to what we're seeing each year. You might be interested to know this, that in the United States, about 8 to 12% of the population is thought to have an addiction, where in healthcare professionals, that number is somewhere between 12 and 19%. But let's just say in the general population that about 92% of the people drink about half of the alcohol in the US, and then 8% of the people drink the other half. So that's not surprising when you look at people who have alcoholic or substance abuse issues. Around 8, 9, 10, 12%, you see that number. So most of the alcohol, or half the alcohol, is consumed by only 8 to 10% of the people. And the other 92% of the people consume the other 50%. Just a little interesting statistic there on alcohol. And then when we look at substance use disorders, we have about 20 million Americans over the age of 12 each year that have been diagnosed with an SUD. About 10% of those actually receive any form of treatment. And as you've heard me say earlier, the overdoses in about 107, 108,000, it actually got to 109 in 2023, the beginning of this year. When you have patients that come to you in your office, they may tell you that they are in recovery, they have a sponsor, they go to 12-step meetings, and they may tell you something like, I've been diagnosed with moderate substance use disorder, or I've been diagnosed with moderate alcoholism, or severe or mild, different grades of diagnosis. So what they're talking about here, just for your information, the Diagnostic Statistical Manual of Mental Disorders, the DSM-5, which is the current version that's used in the mental health area to diagnose substance use disorders, looks at 11 criteria. These are the 11 criteria that you probably have never seen before, but if you have and you know these, you know that it depends on how many of these you have as to the diagnosis that you actually get. So from your physician, when the addictionologist, when they diagnose you, if you have 0 to 1 of those criteria, you will not have a diagnosis. You may have an abuse or a misuse kind of preliminary diagnosis, but you won't have a diagnosis of a substance use disorder. If you had 2 or 3 of those 11 criteria, you would have mild, 4 to 5 moderate, and 6 or more severe. So that kind of gives you an idea of what level you're talking about. And of course, looking at this back here, the cravings, the withdrawal, the tolerance, these are areas that you really talk about. Physical and psychological problems, a lot of these add up over time. And so we see people sometimes have 8 or 9 of these, 10 of these, some have 11, but most are somewhere, in the middle there. So in healthcare professionals, it's not uncommon. We have what's been called the triad of conditions that set us up for mental health issues, such as compulsivity of work, availability of other drugs, and then our lack of acceptance of ourselves, we call it non-acceptance or denial of your humanity, that thing we all deal with called perfectionism. Now, as far as mental health goes, I don't have to tell you in the room, those who are in practice, or the pleasure and the joy you have treating patients. Hopefully, you're at that stage in your life where things are flowing, and you're really reaping the benefits of dentistry. And I'm not talking about money. I'm talking about just the whole environment of your connection with people, how you save people's smiles, you make people more self-confident, all the things, the rewards that we deal with, that's rewarding. But sometimes these can get a little bit out of kilter, if you will. And so we're going to look at the dentist and sort of see how we are, as what draws people to dentistry. And let's look at that. Well, dentistry attracts a lot of good and bad things. I mean, it's not bad to be compulsive, but it has to be a healthy I can't say that word, compulsivity. It can't be like where you become paralyzed and you're constantly just thinking and obsessing and doing things. But you have to be able to balance that with your judgment clinically of what you're doing. Unrealistic expectations. I think a lot of times I hear people say, oh, I'm going to double my practice next year. And I'm saying, how are you going to do that? Well, they don't know, but they're just going to work harder. And of course, we know working harder is not going to double your practice. Unnecessarily high standards of performance. We expect perfection because that's sort of the evaluative judgments we've got from our professors and our instructors through the years of it has to be at a certain standard. And that's good. You want excellence, but not, of course, perfection. We're a lot like dogs, if you will, in a nice way. We like to be petted. We like to be told we're good. We need that social approval. We need that status in society and our practice. We want to be told, you're a great dentist. You do well. Everything's, that's the kind of thing we want to hear. But when people complain and it's not perfect, then we sort of internalize and absorb these emotions that are kind of bestowed on us or we accept in. We don't have other people looking over our shoulder as much. We're very isolated, driven as far as how we do things in our practice, as far as, we're a little entity, if you will. Back in 2017, I think the ADA said it was about 78% of us practice in a solo environment. Today, that number is almost down to 39% because of corporate. And corporate, I'm not anti-corporate, but corporate introduces a whole new thing that deals with mental health and stress and how you're going to deal with all the pressures that brings on. And that's sort of what we're seeing a lot of today. Your commitment to your profession, the amount of time you spent going to school, the amount of money you've put into it. One of the saddest things I see are people who have graduated from dental school and they're excited to be a dentist and they go into practice and 10 or 15 years later, they've lost that spark. They don't enjoy it anymore. And they feel that they're trapped. It's called the entrapment syndrome. I've got all these financial and commitments I've made time-wise and education-wise. I can't do something else. I have to be a dentist, but I hate what I do. And a lot of times it's not that they hate what they do, they hate the system that what they do is involved with. And we'll talk about that. Physical demands, stressors, cottage industry, not so much anymore, but we're still mainly solo. Depression and burnout are not unfamiliar with our profession. And then the personality styles, we'll talk about that later on. Availability of drugs, not so much anymore. There are a lot of stipulations on that now where you can't just order drugs without someone looking over your shoulder, which is a good thing. We do deal with a family system. It is a dental office is a family. It's highly emotional, as we know. Physical demands, I know when you're 20, 30, 40, you're going to say, I'll never have a problem with my back, but backs are common problems with dentists, hands some, but shoulders and backs, necks. I mean, this is just part of our trade and part of our what we go through as professionals. And you will have difficulties, a lot of us, as time goes on. But anyway, y'all are familiar with a lot of these things that kind of draw us into dentistry, while albeit high risk, and we put ourselves up for burnout. I know that Christina Maslock, who talks about the burnout survey or burnout index or inventory, she says that healthcare professionals, professional athletes and actors are in the same category, and we're at the highest level of a profession that is setting ourselves up for burnout. It's not that we will have burnout, but we're at that level because patients and audiences demand perfection, or they're spending their money, they want to see us perform. And we're like little mini clinics, as you know. We're little hospitals when we do our dentistry each day. Dentists still has more heart disease than the average population, and this is not uncommon. Number one killer in dentists is heart cardiovascular disease. It's also true in other professions, but we do work long hours. One of the things that sets us aside from our medical colleagues is that dentists tend to have 2 to 2.5 times greater psychoneurotic disorders than physicians. And commonly that's associated with general anxiety disorders, panic attacks, depression, We tend to take things more personal. We are more isolating, dentists are, than physicians. We're more competitive than physicians, a lot of us, some studies have shown. But so we find ways to relieve the pain. Sometimes it's through pills, sometimes it's through alcohol consumption. And we deal more, I think, with physical exhaustion. And I know that physicians do too, but we do, when we push ourselves, we really can't see what we're doing to our bodies. And so we're more compartmentalized. Physicians are more global. I know that's a 30,000-foot view. That's not necessarily true across the board, but in general, we are more sensitive. We're more sensitive to evaluative judgments of other people, studies have shown. So when we go to dental school, we start out working on a mannequin or working on a person. In medical school, a lot of times they kind of go around in pods and make decisions with other doctors, and they're not really doing surgery or doing something intrusive. They're more like, thinking about the global aspect of it. In dentistry, we're like hands-on. It's interesting in Russian, the word dentistry is mechanic, and I may be not saying that exactly right, but we are mechanics, and that's how the word kind of translates into Russian, for what that's worth. Okay, emotional illness. Dentists are interestingly, as you can imagine, higher. The average population, when they rate diseases or issues they have with their health, emotional illness comes in at number 10. In dentists, we come in at number 3. That's our third most common problem. We do have a lot of dysfunctional personality traits that can be apparent, such as codependency. I want you to like me. And if you like me, I feel good about myself. If you don't like me, I don't feel good about myself, and it must be my fault. I'm a bad person. The shame and guilt kind of goes through, and you absorb those anxieties of patients. Avoidant personalities. We don't like conflict. A lot of times we react to situations as in a passive aggressive type of motion or action. So a lot of times we do have issues with knowing how to really communicate with our patients and with our staff. OCD can be healthy, but it also can be pathologic. And a lot of times we get to this compulsivity of doing things over and over and over and over and over, thinking it's going to be better the next time. Narcissism, fear and anxiety, and then sometimes addiction. So let's look at stress in the office. The 2 leading causes of stress that plays on our mental health. The 2 from a study in England and also in the US say running behind schedule is more stressful than dealing with difficult or uncooperative patients. So the amount of stress level, by far, scheduling is the most stressful of all of the ones listed. Now, that's good news, because we can do something about that. Tomorrow we can go in and do more block scheduling, or do more kind of creative scheduling, where we're not scheduling 2 crowns and 2 root canals side by side all day long. I mean, some people could do that, but it has to be thought out, and whether it's staggered or block or whatever the terms are they use today for scheduling, that needs to be looked into and change that aspect, because that's something you can change right away. And now, when we talk about stress, some of you have seen this, I'm sure, this Yerkes-Dodson law, but this is a bell curve. And of course, we need stress in our life. We need the good stress. We need to be a motivational stress, a stress that causes us to become creative and compassionate. And that's what we want every day in dentistry. We want to go up this hill and come down this hill every day. We want to have that experience of performing, helping, giving back, being effective. But unfortunately, sometimes when that continues on for long periods of time and you become obsessed or perfectionistic tendencies, you get over that side and you're kind of going down the hill. And that's when disease comes in, and commonly you'll see it as burnout. And we'll talk more about that here in just a minute. But a healthy response to stress, it looks like this. It starts out with a baseline. You get a stimulus, whatever that is. Oops. Sorry, let me go back here. Hit the wrong button here. You get a stimulus, and it causes you that fight or flight kind of reaction. You deal with it, you decompress, and then you come out on the other side. And we need to have daily spikes, like a an EKG, if you will, of how you deal with stress. We need to compartmentalize the stress and get rid of it and deal with it as it comes upon us if we can. Now, unfortunately, or fortunately, most of us are more alert, health, more responsive early in the morning. And so most people do their major procedures or major meetings or major techniques, whatever, cosmetic work in the mornings. So you want to peak, by midday, and you're not going to be at the same level of alertness and creativity and acuity as you will be at like 9 o'clock. So you want to kind of, do your heavy stuff in the day and then kind of decrease as time goes on. Well, that's pie in the sky a lot of times. That just doesn't happen that way, but that's the ideal. Now, so you see this little spike up and down all day long, where you're dealing with stressors and then getting rid of it and, kind of dealing with it. But unfortunately, in dentistry, as in healthcare, as in athletics, athletes, and also actors, when we go on stage, if you will, think of a concert violinist that goes out on stage. For the next hour, they have to be on the top of their game. There's no time to relax. So we go out as a lot of times as clinicians, 8 o'clock in the morning, we hit the road running, and we stay at this level of tension all day long. We don't decompress, and then we crash at the end of the night. And sometimes that comes in just total exhaustion. Sometimes it comes in using more and more substances. There could be different ways of dealing with it. But this is something we need to focus on and look at. And that's where we're going to try to talk about this chronic stress, this chronic inflammation, if you will, called burnout. And so the ADA did a study years ago, and they found out that about 2 months out of the year, dentists are either ineffective or disengaged from their work due to stresses. And 86% of the dentists in that survey said they could identify with one of these four topics: exhaustion as far as focus, energy, and mental capacity; mistreatment; decreased case acceptance because they were afraid either not to talk about it because they were tired, or they knew the patient wouldn't accept it, they didn't have the skills to talk about it, or they delayed starting necessary treatment because it required them to learn a new technique. Such as, if you have a population of you that say you wanted to start sleep medicine or orthodontics in your practice, you're going to have to do some education, but you may be too exhausted, too paralyzed, too fearful, too isolating to even look into something like that, because it requires you to open up and to go after it, and you just don't have the energy for it. So there's a lot of procrastination that goes on in burnout and stress. And, I'll do that next year. It's not the way we do it. That doesn't work. And all these terms that we hear people say, we have to recognize that a lot of this is accumulated stress that's talking, and not really what we want and what we know we can do. So just end this section with, this is what stress looks like. It's having a bad day. Okay. This is stress. Okay. On the other hand, the ADA did in their 2015 well-being survey. I'll show you some results here of a survey. There were about 200,000 dentists. I think about 20,000, usually it's about 10%, get the survey. They said that about 11% of us deal with depression. Only 1 in 5 actually seek help for it. And anxiety disorder, 6%, and panic attacks, 4%. So dentists under 40 are more prone to this, more drinking, more alcoholic tendencies, more depression. And one of the reasons is that big term autonomy. They feel that they're spinning, they're not really landing somewhere. They're working for this group, and then they move over here, and they're trying to find where they fit in. And they've got all these bills accumulating from loans, as some of you have. And so in general terms, the ADA just recommended we needed to focus our educational efforts on increasing early coping skills to increase well-being. That's easier said than done. And obviously it's going to take a lifetime to do that, but it's something that you can focus on to learn how to increase coping skills. Female dentists are more prone to what I call the supermom syndrome. They're not only at the office, but they also a lot of times have to go home at night and deal with the children, the home, the meals, whatever the structure looks like in your family. But one of the things too that they deal with that males don't typically deal with as much, in the survey show, harassment at work, and it can come in different forms. So this push for promotion of gender equity and respect and treating women like equals instead of, this hierarchy, whatever. But this is one of the things that really came out of this study in 2015. Now, fast forwarding to 2021, similar results, more mental health issues in dentists under 40. But the thing that was really emphasized here were dentists under 40, only about 47% of those actually knew that there was a well-being program like the Michigan program or the North Carolina program, a well-being program for dentists. So there was a big effort to try to change that. The survey also showed that there was a 3 times increase in anxiety as compared to 2003 survey. And let me just say this, one of the things that we're going to, or I'm currently not on this right now, but one of this board, but one of the things they're going to do is starting in 2021, they're going to have another survey in 2024, 2027. They're doing it every 3 years. Because in the past, it was 2003, 2015, and 2021. So it's kind of sporadic, but this is going to be more predictable to see if we can follow trends of what's happening in our profession with more real-time information. But we know that about 80% of us deal with some type of discomfort at work every day, and that about two-thirds of us have a medical condition that's either being treated or we're aware of. The medical condition is not surprising. I mean, a lot of people have, high cholesterol, blood pressure, diabetes, all different diseases. But the thing is, this anxiety level has tripled in the last, 20 years or so. And you see this little advertisement the ADA did for that. And I think it clearly shows that in the data. So the spectrum of stress, we like the green stress, the good stress, the U stress is called EU stress. The good stress. We like to go up that curve and come down every day, be motivated, have a purpose, a meaning in life. But as things go on, they can lead to burnout, which can lead to major depression, and then unfortunately sometimes in suicide. So we're going to look at burnout this last half hour. And let's just, I'm a big dog lover, you can probably tell, but burnout in dentistry is more common than you may think. And I just want to start out by saying that burnout in a lot of ways is like a hurricane, in the sense that if you stay in the eye of the hurricane and you move around, how hurricanes kind of move around on the map like this, and then they kind of move over here, and they don't just linearly go, they move all over. If you can stay in the eye of that hurricane every day with all the stresses and things coming at you, you're going to be okay. And that's our goal. That's where we want to stay. But unfortunately, when you get whipped out into these winds and you start going around in circles, it's like being on a merry-go-round. And sometimes it's hard to pull yourself back into the center where there's some peace and calm. And so burnout can a lot of times be like this. It's very insidious. You don't recognize it. Sometimes you do, but most of the time you don't. So Dr. Areta and Johnson Leon back in 2004, almost 20 years ago, wrote this classic article, and they said that dentists are more prone to anxiety, depression, and burnout due to our clinical practices and some of the personality traits that we bring to our profession, if you will. And so we set ourselves up sort of like, for all these mental health issues. I know our daughter is a physician, and she was told in all the places that she's worked in hospitals, and she's in a fellow right now, they told her, it says, it's not a matter of if you get burnout, it's when you get burnout. And so they're trying to do a lot today in med schools, and I'm assuming dental schools too, to try to mitigate some of the effects it can have and to be more aware of recognizing what's going on. So burnout, I like to think of it sort of like an inflammation. And I use the example of having a splinter in the back of your hand. If you pull the splinter out and got rid of like a problem and you left it alone, your hand would heal and it would be fine. But if you pull the splinter out, got rid of one problem, but didn't deal with the entire issue going on, and you sat there all day long and hit the back of your hand would never heal. It would constantly be inflamed. And so burnout is like an inflammation that occurs between people and work. And I like to say when they don't play nice together or they don't fit properly. Also, it's a constant irritation. And the only way burnout changes is if you address what's causing the burnout. And we're going to look at that. World Health Organization says burnout is a syndrome conceptualized by chronic workplace stress that has not been successfully managed. Not been successfully managed, key words there. Once they're managed, burnout changes, and you have the potential for change, and you don't have that pressure that you have with burnout. So we're going to look at that. 3 stages of burnout: it's physical, it's emotional, it's psychological, and it's spiritual fatigue that sets in. The 3 signs of burnout, I'm just briefly, I talked about this in Michigan, but at the annual session, but I'm going to briefly talk about this and then talk more about solutions. But the 3 signs: number 1 is the stress dimension. It's called emotional exhaustion. Probably the number 1 thing that you will see in burnout that you will recognize. And I'll talk more about that in just a second. Number 2 is the depersonalization issue, or the kind of you become like you're not caring, you become cynical, you become sarcastic, you get to the point to where you just have nothing else to do with this relationship. You don't like the patient, you don't like your work, you're just in a bad place, and you kind of step aside from yourself. In other words, you kind of not come out of your body, but you're not in the real world. You're kind of disengaged. And then the last one is your work. And I like to think of the work sort of this way. The work performance is usually the last thing that goes down that you'll notice. And I use the visual of a tightrope going across the Grand Canyon, and somebody's walking across with their pole, balancing themselves. That is the dentist walking in life, if you will, that is experiencing burnout, but they're doing everything they can to walk across that rope and look normal, because that's what the public sees. And they want to say Dr. Smith's office is got it going on. They're great, but you may be having trouble, but you don't want people to know that. While you're walking across the Grand Canyon, you may look down in the canyon and you see your marriage is gone, your finances are gone, you're bankrupt, your children don't talk to you. You may have all these other things. Drug addiction may be part of it, but the outside appearance has got to be everything's okay, or as we say here in North Carolina, everything is okay in Mayberry. Some of you that are old enough to have watched that series, Andy Griffith. So you have to look good, and so anyway, that's the work is usually the last thing to go. So emotional exhaustion, probably the number 1 thing you're going to notice. Listen to your body. Your body will tell you something's wrong. If you're this person and you go along like this, and you know how your sleep patterns are, your eating patterns, your exercise, how your day is, and all of a sudden you start seeing this slowdown, or like, what in the world is going on? It's like something has changed in my body. For 2 or 3, 4 weeks, you need to get it checked out. Obviously, it could be anything from hormonal to, thyroid, testosterone, depression. It could be a lot of different things, but it may be burnout. And burnout is easier to prevent than to treat. Typical burnout treatment can take 2 to 4 years sometimes to really treat effectively with counseling. So listen to your body. If something's different, I don't care if you're 20 or 80. Burnout is not a respecter of age. It can happen at any time. And I know we see it in dentists in their 70s, and we see it in their dentists in their 30s, and probably see more in the younger groups than I do the older, but they're still present all throughout dentistry. Compassion fatigue is the term you hear. Depersonalization involved with the sarcasm and cynicism. You have, as I like to show this picture here, this guy says, I just have nothing else to give to this relationship. I mean, he's at his wit's end. It's sort of like going to marriage counseling and you're trying to save the marriage, and you've done everything. Both sides have tried to come to the table, and it's just not going to work. That's the way you become cynical with patients. You don't care anymore. You just can't hear people give you suggestions. You're just leave me alone kind of thing. And a lot of times that's earmarked by isolation, and you just kind of isolate in your office or put your headphones on during patients so you don't have to listen to everything else going around. This is all things that have happened with people that have this. And then the last thing, why am I doing this? Does it really matter? What am I here for? You start questioning the meaning of life and the meaning of why you're here. And you just got to have to, you're just really down. So this Venn diagram shows the interaction of these three main components. There are other components, but these are the three main that people usually test for and look for. So I want you to leave this section knowing that burnout is not a problem, okay? Because a problem indicates there's a solution. However, burnout is a dilemma, and a dilemma demands a set of strategies. And that's what we're going to talk about now, strategies of how you can correct or deal with some of the burnout you're dealing with. So the dental burnout origins, are they rooted in the physicians? I know there was an article that came out about 10 years ago in the New York Times that said 50% of all physicians in America are burned out. And their question was, is it rooted in a few weak individuals that just can't stand the heat in the kitchen? Or is it the workplace? Is it the environment they work in? And, you might say, well, in physicians, it's probably the workplace, the hospital and everything, because they're so different than dentists. But the reality of it is and again, I'm not anti-DSOs or anti-corporate model, whatever. Some of that, and even private practice, can lead to issues with dealing with the stressors. And so my every indication shows that dentistry is going down basically the same road that medicine has. That medicine has. And so we've got to be careful, because we're just, years behind, maybe going into that same kind of system where the EMR is still number one reason physicians claim create the most stress in their life. Almost 90% plus always use that as the number one issue. And for physicians with setting personal boundaries and being able to deal with the environment they work in, all these issues are same in dentistry. It's just that we're in little mini hospitals, if you will. Excuse me. This one study, it came out of Barcelona. It was looking at some graduate school programs, and they found out that due to our OCD-ness, if you will, and our personality, and we've talked about that, impulsivities, and our excessive need for positive emotions. We need people to tell us we're good, we're doing well. And then the narcissistic personalities that a lot of us have, we are at the highest rate to set ourselves up to develop burnout. Now, this was a very small study. There's only 78 participants, but it still indicated this information. I wish there would be more done, but there just hasn't been a lot in dentistry done yet. And if you think about it, in dental school, forget dental school, go back to when we were in elementary school. We were, we got the good grades and the stars and the trophies, and then we get in high school and make the good grades. We go into college, valedictorian, and we go to college to dental school. And all along that way, people are telling us, oh, you're so smart. Oh, you're so good. And they're, petting us like a dog. You're just wonderful. You're wonderful. You're wonderful. And you build yourself up as this overconfident person. And then when you get in private practice, there's nobody coming in and saying, that's a great looking root canal. Oh, I like the way you prep that tooth. Could you show me? There's none of that. If you're in a group practice, you may share, in treatment planning sessions with other doctors, which is good, but you don't get that constant admiration. And that's something that can lead to burnout. Younger dentists, student loans, I'll just say, we've already talked about alcoholism increase and also the exhaustion, but student loans are right now about 300,000 according to ASDA. And the way to think about that is that it's gone up from about 4 times since 1996 in the amount of loans. So this is what all this accumulated inflammation, if you will, or accumulated issues that we deal with. This is what burnout looks like. And you just don't have the energy or the focus anymore. And you're wondering, how am I going to get out of this? It's like you're in a funk. So in summary here, stress, and when you're stressed, you're overengaged, you're doing too much. And burnout, you're disengaged. You're just not wanting to participate with life. And stress, your emotions are overactive. In burnout, they're blunted emotions. For urgency, in stress, everything's got to be done now. It's got to be hyperactivity. You're constantly doing. In burnout, you feel hopeless, helpless. Why do anything? Stress, you lose your energy. Here in burnout, you lose your ideals, your hopes, your direction you're going, what's your purpose in life. Stress is earmarked by anxiety disorders. Burnout is earmarked by detachment disorders or sometimes depression, clinical depression. Primary physical damage, you notice it in your body, in blood pressure, cholesterol, overweight, whatever. Burnout, unfortunately, it's more emotional, and it's emotional damage that a lot of times is hard to fix on your own without help. Stress in stressful situations, the disease is apparent. I mean, your blood pressure is up, your physical signs are not good when you're overweight or not exercising or not eating right. Here, it's more about, why am I here? And stress is easily identified and treated. Most of the time, burnout is not it's not always identifiable. And a lot of times you do deal with more and more stress, or more and more burnout. And then the damage is already done. And it's hard to know where to turn for help. And then with stress, it's a lot of times the individual will recognize it in burnout, sometimes, but not always. Burnout is sort of like a disease, a process, and a condition. It's all things. It can happen, but a lot of times are not aware of it. So the 6 mismatches leading to burnout in dentistry. This is directly from Dr. Christina Maslach, who is the author of a lot of the research. She and Dr. Michael Leiter out of both in California, they write a lot of the books on burnout, and it's really interesting to look at the workplaces. So what I did when I read her books and looked at her, information over the years, is that I tried to apply it directly to dentistry, not just saying people who work in healthcare or people who work as athletes or people who, that kind of stuff. So we're going to look at the mismatches that occur in dentistry. And there's 6 of them. And for those who were in Michigan at the annual session, you saw this, but we're going to talk a little bit more about solutions. So the first one is being overworked, work overload. Number 2 is lack of control in the office or in your life. 3 is insufficient rewards. I know a lot of people immediately go to money and they say, I'm not being paid enough for what I do, but it's more than that. And we'll talk about that. Breakdown of community. The people don't play well together in the office, if you will. The absence of fairness, where the staff feels like one person is being mistreated or undertreated or overtreated, favoritism, that kind of stuff. And then conflicting values, asking a staff member to do something or to do a procedure that's not ethical or moral. And so we'll look at each one of these. The work overload, obviously, we've already talked about some things you can do right away is to change your schedule. There are many courses out there that you can go online, get consultants in to help you with scheduling if you're not familiar with how to do that. We need to go from, a big emphasis on this is to work with your delegate information, delegate procedures, delegate and trust your employees to do procedures. A lot of times the dentist feels like he or she has to do the temporary, and he or she has to pack the cord. A lot of times you'll find that our assistants and hygienists want to do these things. They want to be part of the system, and they want you to value their work. So there's a part that you need to let go. And in my opinion, to help with your work overload, because I find that as one of my friends who was a dental assistant said, I don't wake up in the morning and hit the ground running thinking, oh boy, I get to suction spit and saliva today. That's not what they're there for. They want to be part of the process of delivering good health care. So, use them. They're there. Obviously, quadrant dentistry versus individual tooth dentistry, that can really weigh you down. So you need to have systems of doing quadrant dentistry. Typically, people doing quadrant dentistry might give a 5 or 10% discount on the total cost if you do it all in one day. There's ways to do that up front, get the money up front, or have however you want to handle the money. But a lot of times letting the patient know they will get a discount if they pay in full, that helps. As far as perfectionism and procrastination, these just kind of creep up on you. And sometimes I hear people saying, I've got to do it over, I've got to do it over, I got to do it over. And they keep thinking they're going to come closer to being perfect. And anyway, it's excellence that we're looking for in clinical dentistry. Lack of control in the office. You can't help, or you can't control that patients don't show up on time, they don't pay their bills. Insurance companies say they're going to pay this and then don't, or insurance companies don't respond to you. Patients send out negative reviews about you because you didn't give them opioids after their third molar extraction. Or, Ms. Smith says, doctor, while I'm here, do you mind doing those other 2 crowns? And you're going like, production, this is good. Well, how am I going to fit in the schedule? Because I got a tight schedule. And so you have all these things that come, these external variants, if you will, or variables that come up. And then the increasing, as we all know, this increasing administrative paperwork, if you will, that a lot of times you can't control. It's just something you have to deal with. So in order to deal with these, sometimes bringing in an office manager to look at how you practice, to help you maximize your efficiency and maximize, different systems, the periodontal system, the crown system, the extraction system, whatever, how the workflow is to maximize it and to get the scheduling down so that the 2 can work together. Insufficient rewards. Again, we've all had that feeling, I'm sure, that I can't believe I'm doing this for this amount of money. It's like I'm working myself to death. But the reality is, money is not usually the motivator for people to stay at a job. It can be initially, but it's not long lasting. And motivation to keep people at work, and this is a big like a secret here. So this will be something you'll want to take home. The motivation for keeping people at work and enjoying what they do is to recognize them and to accept them. Because my good friend, Dr. Chip Dodd, he's written many, many books, but he said the 2 greatest needs of any human being in the world is to be accepted, that belonging. That's why we see people join clubs and churches and gangs and, all different groups, but you want to feel like you're a part of, to be accepted, and you want to know that you matter and that people know that you are part of the process of what you're trying to do, whether it's work or family or whatever. So the need to be accepted and recognized is so important. And other things, insufficient awards, it's just all the increased time and money. It kind of bears down on you when you feel like you're working for peanuts, as it says there. But again, the 2 biggest things you can do for your staff, money raises will last 2 or 3 weeks, and then it goes back to the same baseline of, oh, I'm still not happy, but it helps. But recognition and acceptance, saying thank you, and thank you for being here today. I know you didn't have to drive 30 miles or take the subway or whatever to come to work today to be here, but you wanted to be, and we value you. And you express that to your patients in front of the patients, that how you value this person, and also other staff members. We all need to be on the same playing field. Break down a community, another huge one. You'll start seeing people come in late. It's usually associated with, well, no one knows what's going on in the office. No one knows what he wants. I mean, if he'd just tell us, or if she'd tell us what she wants, then we could do it. Well, what do you do? Well, I do it different. Nobody really knows. And you get that no appreciation. And then you have this thing of triangulating, where the DA1 and DA2 don't like RHD1, who talks about the front desk person 1. And, that it's all this communication and stuff that's not being, it's kind of triangulating, and tension just continues to stress. And then one day you walk in and there's this big elephant walking down your hall, and you're going like, how did we get here? Well, a lot of times not dealing with this. So you need a leader in the office who has direction, who communicates effectively and tells the staff, this is what we're going to do. But you don't do it like a dictator. You do it through having staff meetings where you value and you recognize and you accept their input from all staff members. And then you come up with a plan that you think will work. I know this sounds like pie in the sky, but this is where you start. This is how you break down this tension. So again, Chip was right again on that. Being unfair, this is favoritism. The hygienist always gets more than I do for a raise. He always does more for her or him. All this kind of appearance of inconsistencies. And that could certainly be from community also, where the community kind of triangulates and talks about different parts of the office not being fair, and then all this tension drives comes up. And then conflicting values, the ethics, the accountability. You see this cognitive dissonance, this where you know what you're being asked to do or what you're doing is not really legal, moral, ethical, but you feel like you have to do it because it's part of your job. And certainly, we're down this month in production. I want everybody all the hygienists to get at least 2 crowns off of every patient. And you're going like, what? That kind of stuff. And that kind of stuff does go on. And so it's a real issue. And we'll talk more about this. Now, I do want to spend just a minute. In North Carolina, we did a burnout survey during COVID. And we found out that dentists, about 18% of the dentists and about 14% of the hygienists in North Carolina actually were experiencing or indicated from this poll survey that they were actually suffering from some degree of burnout. I want to just look at the other side of that equation, if you will, and look at the ones who said they were fully engaged with their practice, that even during COVID, they were able to deal with all the stressors. And you look at dentists, about 43% said they were fully engaged, about 38% of hygienists. But when you look at burnout at 18% of the dentists and 14% of the hygienists, that together, it's not as great, thank goodness, the burnout level. But when you look at this next section, this is the one that kind of got our attention here in North Carolina. 37% of the dentists and 47% of the hygienists said they felt ineffective, overextended, or disengaged. And then there were the burnout people. So during COVID, we looked at these numbers and we found that about 56% of dentists and about 61% of hygienists were either burned out, ineffective, overextended, or disengaged. So we felt like it was necessary to do courses like this to make people aware of how you could change some of the environment that you're in. And so just briefly here, this is looking at work overload. The issue might be I'm constantly running behind schedule due to patient overbooking at the front desk. A solution might be at staff meetings, we address weekly how we can more efficiently maximize scheduling. So they're bringing up that elephant in the room, scheduling. Lack of control. Sometimes I don't feel trusted at work because my dentist is always looking over my shoulder. A solution might be where you trust the employee and he or she says it's a great feeling to work here because my dentist trusts my work and makes me feel like a team member. Key point there, acceptance, recognition. Insufficient rewards. My dentist never thanks me, much less knows what I do here. Boy, have we heard that one over the years. And then a solution might be my dentist, as I've already said, recognizes me in front of patients and other staff members, which makes me feel appreciated. Breakdown of community. Our office is so disorganized, no wonder everybody blames each other for the chaos. There are offices like that. A solution might be our dentist encourages input from the staff members to make decisions. Get your staff involved because that tells them that they're recognized and they're accepted. Not that you do everything they say do, but it gives them a chance to give feedback. Well, anyway, I've hit the wrong button again. I seem to be. Let me go through here real quick. The next one after that would be the favoritism. A person may say something like, he always plays favorite. She gets more bonuses than I do. And then one solution to that, and it's coming up here, so I don't have to ad lib this. But under absence of fairness, as far as bonuses go, it might be that my dentist gives her employees a common purpose for being at work. So you value your employees with a common purpose, and you talk about respecting them in front of other people, and especially amongst each other and with the patients. And then conflicting values, you may have a front desk person that was told to go ahead and submit insurance claims, even though they hadn't done it yet. They're going to, but they were needing to meet overhead. And that's not right. Or the dentist telling a hygienist to do something they can't do legally under their license. And so the solution there would be to have an employee where they say they love their job because they're respected, trusted, and they're part of a team. The work is fulfilling, and we treat our patients like we want to be treated. So in key mismatches, the top 6, I'm going to give you some key words to take away. When there's work overload, look at your schedule. When there's lack of control, Loss of autonomy is huge because you feel like you're not effective anymore. You don't know where you're going. Look at the autonomy. What do you need to change jobs? Do you need to focus more on more education? Where are the solutions? Insufficient rewards. Is it really worth being here? A thank you goes a long way. Break down a community. This term that Christine Maslock uses called horizontal violence, where people just take all the abuse and then eventually they lash out at their fellow workers by yelling, screaming, acting out. Absence of fairness, favoritism. Look at those to see if you are actually doing that. And then, of course, values conflict. It's an erosion of one's soul. And so I like to say that fulfilling work nourishes one's integrity, self-respect, pride, and purpose in life. So strategies, we talk about working. In the past, it's all been about fixing the worker. As some of you heard me say the other day, eat more yogurt, exercise, ride a bicycle, get more sleep, exercise. All that's fine. It's going to make you feel better, but it's not going to take care of burnout until you address the workplace if there's an issue at workplace. So we have to look at both areas. In medicine, the New England Journal of Medicine talked about a survey, or they did a survey, and they asked physicians what are the two biggest areas they felt like that would get them less burned out, lessening the provider burnout. The two areas were engaging them in decision making and empowering them to make decisions and to actually doing real change in the hospital or in clinics. So we got the same thing here, where we got to look at our productivity and efficiency, how we're scheduling, what type of practice we want to have, and then on foundational focus, the well-being of the practitioner. Take care of yourself, obviously, take care of your staff. Take time at lunch, during lunchtime, do these things, get out, walk, take a nap, whatever. Don't sit there and fill out charts and do interviews and all this kind of stuff. Get out of the office. The time you spend away from the office is as important, if not more important, than the time you'll ever spend in your office. Control your schedule, systems, marketing. Hire someone that's a marketer. Don't try to do it all yourself. I know nothing about social media, a little bit, but not a whole lot. Get someone who's trained to do that, to take that over in your practice. Look at all areas of your practice. Listen to your staff. Talk about bonuses if you don't give them. Case acceptance has to be staff driven. The doctor can't come in like some kind of authority and say, this is what you need. You have to have that support, and that's bound in community and looking at each other as co-equals. Use CAD/CAM, AI, machine learning that's coming, and more of it's out there now. That will help a lot of times reduce frustrations and time. Hang around with the winners, set boundaries, what you will and won't do. I mean, there's just so many things we could talk about. But I do say that, if you're on call, don't try to take it all yourself. Hire a call agency to take it for you, or share the call with another employee or even another dentist. And when you do, if you do have symptoms of burnout, look at it as a positive indicator an indicator for positive change in your life. Harvard Business Review had a nice article about burnout. Get rid of things that aren't working. Review and retreat your office, if you will. You're going to have to do some surgery on your office. Sometimes it may be physical, it may be working with other employees, as trying to fix things that need to be fixed. Some people are opening up like health kitchens in their office where they're having someone come in and cook one time a week, healthy foods, massage therapists come in, all these different things you can do. But the whole thing is that it's about a we concept, not an I concept. I can't fix it, but we can. I'm going to leave you with this. Well-being, structure regulates emotions. Very important to have structure in our life. Routines and frameworks lead to health and well-being, and social connections and routines help to mitigate depression. So lastly, develop a collegial community. Have a friend you can go to lunch with, a colleague that's not a dentist that you can talk to, an accountability partner that's not a dentist that you can talk to, a life coach. Some of you may want to use a life coach. And then lastly, a mentor, someone that's preferably not a dentist, someone outside the profession, but also go with your another dentist and make a routine of going to lunch once a month or something like that. Set a date to do this so that you can keep in touch, because we want to look at each other as colleagues, not so much competitors as a lot of the indications are today. So these are the things I've talked about. And the last thing is address the workplace if it needs to be addressed. And a lot of times that's where the beginning of burnout starts. So nothing changes if nothing changes. And I'm hoping that you could take a few of these pearls away to maybe look at a couple of them, scheduling, respect your employees, and looking at systems in your office. Those are where to start with this change. So I do thank you